together, leading this vanguard of integrative medicine. And they sacrifice their lives, their houses, their time for this. And it's been an immensely inspiring progression. They are leading for the College of Medicine now. And I think today, regard yourselves as the beginning of a new era, history in the making, because the convention today, I think, will be an enormous convention and a movement of tomorrow, and they started it. So can we just give them applause? Because when I set off yesterday afternoon for London, my wife said, "Why on earth are you going to London and leaving us all on Saturday?" And I said, because it's really, really important. It really matters. And it matters not only to our patients in the nation, but also in my own personal life has mattered a great deal, because integrative medicine saved my life. I remember being a GP 10 years, a very conventional GP, and I remember driving into work one morning, it was raining in Devon, and I thought, can I stand another day of surgery seeing patients who are chronically tired, who have back pain, who are stressed, who are depressed, irritable bowel, ME, with nothing in the cupboard to offer them? Can I take the frustration of yet another day in surgery, leaving them empty-handed, with frustrations on both sides? And that was when things clicked for me on a personal level. And I regard what we're talking about over the next 2 days as medicine in colour. It's medicine, it's about relationships, just as Tony said. It's about respecting the fact that we are healers, whether we're patients, doctors, nurses, or therapists. So I think what we're discussing here is something very much of the moment. And what I want to do in the next while is to look at some of the current challenges, because there are quite a few, and most of you will know those. I want to say why I think we are on the cusp of a new era, to talk a bit about social prescription, primary care networks, and then take you down to Devon for a taster of life there in general practice. So, it's a bit like this when it comes to complementary medicine and the health service today. Storm clouds everywhere. We've got a very conventional, rather angry lobby that is very opposed to complementary medicine. And I call it scientism because it's not science. It's because people are purely looking at the biomedical and not incorporating the psychosocial, not including the relationships, the minds that Toes just mentioned and illustrated. And then we've got the NICE guidelines, obliterating complementary medicine. We had back pain a few years ago where sensible guidelines suggesting manipulation, acupuncture and the rest now withdrawn. Acupuncture now withdrawn from most of the NICE guidelines, the palliative care guidelines changing. So we've got, if you like, right at the top, the scientists rejecting complementary medicine. And even NHS England is turning its back with the abolition of homeopathic and herbal medicines just recently, in the last few months. Very bitchy, because the total spending on those homeopathic and herbal medicines was £90,000 a year. And yet we spend well over £100 million a year on constipation medicines alone, all of which could be, or most of which could be sorted by proper lifestyle and the rest. So this was just simply, if you like, as I say, a bit of bitchery, really. The College of GPs sent out, told GPs like myself, we should no longer be practicing homeopathy. What a terrible cheek. I wrote to the chair at the time and said, one, I wasn't going to do anything about what she said. It wasn't the current one, I should say. But secondly, I thought this was McCarthyism at its worst. How intolerant can you be of patients and clinicians by telling them what sort of medicine they should be practicing? And it made me really quite angry. And as a fellow of the College of GPs, colleagues, I said they must start listening to people who are actually on the front line, listen to the patients. And I heard a wonderful interview. The new president of the Faculty of Homeopathy on the Today programme was battling it out with the BMA. And at the very end of the programme, he said very gently, with John Humphreys on one of his last days in the Today programme, he said, look, I take all you've said, but why don't you just come down to my surgery? Why don't you just meet the patients who've been helped? Why don't you just talk to them instead of just barracking away? And then we find that some complementary practitioners say this is good that the NHS is against us because that gives us greater currency. And that's a real pity for me because I feel I would like all patients to be able to access these things and not just those that can pay. But as I say, there are two views. Why are people so opposed to complementary medicine? Well, they say there's no evidence. And I think that is a bit rich because I think there is lots of evidence for lots of complementary therapies. But perhaps not always in the vernacular and the language of conventional medicine. That's, say, double-blind, placebo-controlled trials, which may be very relevant for heart attacks and cancer, but possibly not so relevant for much of the long-term disease, which is 80% of what we see in medicine today. And it is a bit rich because no one's funded the research anyway. 0% of the NHS budget was spent on research in complementary medicine in the last 3 or 4 years. And it's also been the wrong sort of evidence because what we need is very practical evidence. What I need as a GP is if someone's got a headache, which is better and more cost effective? Is it seeing an acupuncturist? Is it taking tablets? Or is it doing this or that? There's very, very little of that sort of evidence. There was some a few years ago. There's a wonderful trial done. It's great to hear someone come from Belfast, because it was in Belfast. And they took some GP practices, and the doctors were able to offer free patients homeopathy or herbal medicine or manipulation. And the results of that were pretty alarming in terms of the patient improving, their health improving, the GP saying that it had been a really positive experience for them. Rather like Toe, they found their surgeries were emptying out because people were being treated elsewhere. And this was an incredibly positive study. And then a number of us said, let's do that study in England. And Alan Johnston was then the Secretary of State for Health. And he said, yes, let's do it. And we formed a committee, and we had Sir Cyril Chandler, who was going to chair that, to look at what were the cost effectiveness of GPs being able to refer patients to complementary practitioners. And then he was made Home Secretary. Very sadly, after that, the current Secretary of State, which I've been barracking, have not put the money towards that. But until we've got that sort of evidence, it's very rich to say there's no evidence, because no one's prepared to actually gather it in the first place. And I think personally, I've never seen an average normal patient. It'd be nice one day too, but we're all different. We all have different aspirations, hopes, and different mechanisms, and some treatments help and some don't. And we're totally disrespectful now of the N equals 1 treatment, the personal testimony. Everything has to be the imposition of population-based medicine. And I suppose, for me, the message of integrative medicine is about changing that paradigm, which is the scientists produce the evidence, the clinicians interpret it, and then the patient, like Alexander Beetle. Do you remember Alexander Beetle at the end of Winnie the Pooh's Walk in the Woods? The patient, like Alexander Beetle, being the recipient of all this great wisdom and this clinical advice. That is yesterday's medicine. Tomorrow's medicine is the patient at the centre. The patient listening to the clinician, if the clinician seems to be saying wise words, and then that clinician using the evidence that he's got, but it being based upon the patient, not upon the system. I hope in future that our clinicians won't simply be the purveyors of population-based medicine. They ram down on their poor patients using clinical pathways, but without even thinking or accepting the individuality of what we are. And then there's the safety argument. And there's so much said about the lack of safety of complementary medicine, and how rich can that be when 2,000 patients a year die from anti-inflammatory drugs. And you know, even I read last week something quite simple like ranitidine, which is reduces acidity of the stomach, is suddenly becoming something that's withdrawn from most of the pharmacies in America. And almost every day there's a scare of some conventional treatment or other. Certainly complementary medicine on the whole is very safe. Jerry Turner are leading a movement to try and make sure that as many complementary practitioners as possible know about red flags, because I think that will make it even safer. And I should add that the osteopath in my surgery in the last 2 years has referred to me one person with secondary cancer, another with giant cell arteritis, and another with a malignant melanoma, which would not have been picked up if he hadn't actually sent them to me at an early stage. So, you know, to me, the safety it's much safer if we work together. And the trouble is we don't. There's a communication block. 2 studies have shown that 50% of the time, patients don't feel that they can talk to their conventional doctor if they are taking a complementary remedy or seeing a complementary practitioner. That's terrible, and it's fairly consistent. And whose fault is that? I don't think it's the complementary therapist. I think it's because conventional medicine has made them scared, because they feel they're going to be judged. And that's really dangerous. If you're taking St John's wort and then you put somebody on the pill, you know, they might get pregnant, and etc. It's very important that there's that communication. And then regulation. Regulation, it's such a sad story. I mean, we fought for herbal regulation 2 or 3 years ago, regulation of herbal therapists. And the Secretary of State then actually produced a thing saying, yes, we're going to regulate the herbal practitioners. And then, unfortunately, another Secretary of State took over. This happens the whole time. And that Secretary of State said, no, we're going to have a 3rd inquiry. There'd already been 2 inquiries where the clinicians and the patients had said they definitely wanted regulation. So, no, we're going to have another inquiry. Anyway, to cut a long story short, with the influence of some malignant royal colleges, regulation was refused. And the main reason, which came from some of the heads of the royal colleges, was we should not be regulating nonsense. If we start regulating herbal practitioners, then we are giving some credibility to herbal medicine. We don't believe in it, so it should be regulated. The college's reply on that, incidentally, was thousands and thousands of people can see herbal practitioners, so regardless of what you think about herbal medicine, surely it's important, it's safe. And furthermore, the BME population are disproportionately high in their use of herbal medicine. So you're saying to some of the most vulnerable people in the community, we're not going to bother doing any regulation, we don't care. And the reason why it was refused was the politicians were afraid of some very powerful, very dyed-in-the-wool conventional practitioners. And I just hope we won't see the sort of shameful affairs appear in the future. And the way to do it is safety in numbers, is this convention to become bigger and bigger, to create networks and really start demanding a slightly better attitude from those on high. Well, 20 years ago, it wasn't quite as bad. When I joined my practice 40 years ago, one partner was doing homeopathy, another partner was doing manipulation. It's quite usual for GPs to do integrative medicine. This is the sort of quote you might have seen at the time, which was actually in one of the medical journals in 1997. And this was another quote from the same article. And I'm giving you these quotes because you'll be slightly surprised as the 2 authors who co-authored this particular paper. And unfortunately, some people decided, for reasons best known to themselves, to suddenly become enemies of the very thing that they tried to support over so many years. Anyway, the dawn is rising. Things are about to get much, much better because of a disaster. Never waste a good catastrophe, they say. The current medical vernacular is not working. Things are getting worse in spite of more and more money, more and more clever plans and strategies, public health, etc., etc. The levels of obesity, diabetes, long-term disease, depression, all going up. in spite of our efforts. So we're not actually succeeding with our current state of affairs. Worse still, we are caught in what those optimists at the Department of Health call the scissors of doom. And the scissors of doom are the upgoing blade, which is the increasing costs of the health service, increasing numbers of patients with dementia, increasing costs of new drugs, elderly population. I've got 2 times as many 70-plus-year-olds in my practice as I had 25 years ago. And in this blade, the decreasing amount of money to pay for it, and the decreasing number of doctors and nurses, and people not wanting to become GPs in my particular part of the world. So we're caught in that. So we're heading for the rocks, and that has to change the way we think. We're over-medicalised too. The British Medical Journal started itself a campaign to stop the over-medicalisation of the population. We're beginning to realise that this is happening, and there's a wonderful world movement, which I'd only recently heard of, called quaternary prevention, which is a movement that is fighting against the overuse of drugs that are harming people. And shamedly, 11% of the population long-term, about 25% short-term, we are coshing. We're coshing with depression, with drugs for depression, sleeping, or pain. Often patients whom we can't diagnose, for whom the mutual agreement is, well, let's just give you this stuff and cross our fingers. And it's atrocious. You all know about the opiate issues going on in America that are not far off the scene here in this country. And then NICE reduces the risk of coronary artery disease when we have our computers and you come in and you're 60-year-old, normal blood pressure, normal sugar, active, to 10%, which means that almost every patient over 60, certainly the males, will now have to put on statins if we obey. But thankfully, if you talk to many GPs, they think this is really absurd, and I think the revolution is beginning even there. The thing that's changed the conversation, though, quite substantially over the last year is the report that came from Bristol showing that GPs with interest in complementary medicine used antibiotics 25% less. Now this has really put the cat amongst the pigeons, because on Thursday the college had a meeting at the Chelsea Physic Garden, in which we started exploring what were the alternatives for things like upper respiratory tract infections and the like. NICE, bless its heart, has at last, for instance, accepted pelargonium, which I've been using for 15 years, and which is the third most used over-the-counter medicine in Germany, as a self-care, proven product for upper respiratory tract infections. But on the whole, if you go to the NHS website, if you've got a cough, you've got a cold, you've got a sinusitis, the advice is rest, lots of fluids, and painkillers, which leaves us very bare as GPs when often people are saying we want an antibiotic because that helped us last time, and we're not going to leave until you give us an antibiotic. But if all you can say is rest and hot fluids and whatever, it's just not a very convincing story. So we met on Thursday to try and look at what were the various things that you can offer in terms of diet, in terms of complementary therapies and medications. And I thought that was going to be a rather little insignificant meeting with about 20 or 30 of us, until we found that we sent letters to NICE, Public Health England, NHS England, and the Chief Medical Officer, all of whom wrote, couldn't tell at short notice, saying, will you please write this up because we need to know it. And then, from the head of Department of Health, said, can you produce a briefing note after this note for the Minister? A sudden recognition that even if they thought that complementary medicine was a load of tosh, at least it might help them to overcome the problem of antibiotics. And you know, something like 1 million people a year are already dying from resistance to antibiotics, and that's going to double in 10 years. And unless we get a hold on this, it will happen. So in a way, the the movement, the tectonic plates are moving in terms of priorities, and if complementary medicine, integrative medicine is seen as a way of reducing over-medicalisation antibiotics, that is, I think, a really important door in. As is personalised care. Personalised care is now national policy. There's a personalised care unit at NHS England. I work within it in my role as National Champion for Social Prescription. And that is trying to bring in personalised care. What is personalised care? Well, it's about caring for the person, not just putting population-based medicine and telling them take it or leave it. So I think the revolution is beginning to happen in all sorts of interesting ways. And we've got powerful advocates. Prince of Wales has been saying this for many years. He wrote an article in the Journal of the Royal Society of Medicine saying as much. And though they don't know it yet, at NHS England, their policy is leading inevitably towards this as well, because the more you look at self-care, the more the complementary and integrated approaches apply. And it was interesting because a few years ago I brought together the leaders of the BMA, the General Medical Council, and all the Royal Colleges to discuss self-care. And I said, is there in fact a slightly different level of evidence that's appropriate when we suggest that people self-care from what we actually suggest when we're doctors? And they said yes. They said, and bless them, they recognise the fact that if you activate someone in their self-care, that's 30 or 40% likely to work before you started, let alone what you actually suggest. And there was a recognition that we don't have to have double-blind placebo-controlled trials in terms of self-care, provided it's safe, provided it doesn't, people aren't not taking a treatment that would really help, then surely that evidence base can be a bit different. So what I'm trying to say is I think our is coming, and I think,